And I wanted to, of course, again, thank the National Association of City and County Health Officials, NACCHO, for the funding and support to make this symposium possible. So before I introduce our next speaker who will open this important session about harm reduction work in the era of COVID-19, I'd like to actually take a moment of silence, for all of us to take a moment of silence in memory of those that we have lost to overdose. Okay, now, without further ado, I would like to introduce Miss Ian, the Executive Director of the San Francisco Drug Users Union, who's going to speak to us about harm reduction workers and being essential workers. Over to you, Miss Ian.
Hello, everybody. I don't know if I've done like a thing that's not a panel, so bear with me. Like if I tell a joke, I might laugh at it myself, so it's not awkward. I don't know. Bear with me. Either ways. So I am Miss Ian. I work at the San Francisco Drug Users Union. It's a smaller needle exchange. We do naloxone distribution. We just do all the basics. We do some wound care stuff. We finally got nurses working at our spot for most of this year. And then I would say probably the reason why I got picked to do this work or this talk was because at the Drug Users Union, we hire almost exclusively people who are actively using drugs, have previously used drugs, or who have been formerly incarcerated because they were using drugs or selling drugs or any of that. So people who have been really affected by the drug war, I'll say. So when I got asked to, I don't know, talk about what it's like to be, or how harm reductionist is an essential worker, it's been interesting to see, I don't know, sort of that rhetoric happening all over the states, and how, like, what essential means, because it has a little bit of like a patriotic propaganda feel to it for me a little bit. It's a little kind of leans on the martyrdom stuff that harm reduction already leans on. So I don't know, but I would be really curious to see how fast people are burning out these days. Yeah, I do not want to die for my job, and I don't want to have it that me saying that means that I don't care about the work that I'm doing, right? And I think that moving ahead in harm reduction hopefully means that we can say things like that or hold better boundaries, especially when it comes to our own physical and mental health. When I think about COVID-19 right now at my program, speaking of physical and mental health, I would say that our biggest issue, just because in the Tenderloin where we are, we haven't seen any positive cases of coronavirus yet. I mean, like, my team, we're ready to take temperatures, refer people out, do all sorts of stuff, but we haven't seen not one report back to somebody that we know. But because we hire from the community, and all of our participants have usually some sort of physical health diagnosis or mental health diagnosis, that we've noticed that everybody, like almost across the board, everybody's symptoms, whatever your symptoms are, have all amplified, right? So we're all dealing with a more pronounced, more pronounced symptoms, and more, how would I say it, like more impulsive. There's a lot more anger. There's a lot more, like, I want to say, like, snippy, sarcastic attitudes. There's a lot more depression. People aren't like day-to-day sad. They're like deeply sad, which also we're learning is a symptom of fentanyl withdrawal can be very extreme anxiety and very extreme depressive episodes. We've seen a lot more fighting. I noticed that I started burning out really quick because I was just breaking up fights, not even inside our program, but like outside on the sidewalk, just going to and from a corner store or going to and from was it to like meetings or to the bank or something. Fights, lots of fights. People are more prone to have their emotions be a lot more extreme. Like there's a lot more crying. People are crying at the drop of a dime. People I've never seen cry before. There is a lot more stealing. I know a lot of our programs have stealing issues, but it's been sort of constant and nonstop. The uglier stuff is more like manipulation and lying. That's happened a lot. And I'm saying all these things, hopefully this isn't getting you all down, but hopefully it's validating that a lot of programs, I think, are going through these exact same issues. And a lot of the internal stuff makes it feel like that these jobs are going to be impossible. And that drug consumption has increased a lot. And we all know that I think when you're doing more drugs, that also makes you more, whatever symptoms you're having with other things, that can make that more pronounced too. And it can make you more sensitive in a variety of ways. So also here in Tennessee, the quality of the heroin and the fentanyl has gone down a little bit. So there's increased consumption because of that. So what do we do? Or what have I been doing? And what have my team been doing besides struggling? I'm joking. Well, yeah, it's weird when there's no one there to laugh at. I would say the first thing that I keep having to remind myself about is to slow down. Whatever you're doing, all of these things make it feel like you have to speed up to catch up with all of the problems that you're experiencing, but just to slow down. It's not easy, especially for me at the moment, but prioritizing teamwork, sometimes it feels easier to just attack each problem individually, but trying to keep your team together and sturdy and working together is always better in the long run. I think a lot of this stuff too is like stuff that you might already know, but stuff that I'm having to remind myself a lot about. Doing a lot of check-ins, reminding ourselves that everybody's going through it right now. So not just you, because it feels really crappy to be going through a lot of stuff and then have someone come in and yell at you because they're projecting something onto you. One of my staff members the other day said, staying on top of the social distancing stuff has even been difficult because when you ask people to like you're standing a little bit too close, people feel like that's targeted. So that they're doing it just to them and not to other people. So being really mindful of your vocabulary, it definitely feels like you're walking on eggshells all the time. But like I said, go slow. Definitely remember to go slow. And forgive yourself if people get upset at you, because it's going to happen a lot more than it was happening before coronavirus. Another problem that we had is making sure that we're keeping up to date on our resources, because people don't have a lot of energy to even walk somewhere when they're being referred out. And if that place isn't open that day or they've moved offices, it can be really defeating to walk all the way, whatever it is, 5-10 blocks somewhere, and then realize that that place doesn't exist right in that location anymore. So we've been trying to keep up to date with all of our research and our facts and our phone numbers and addresses. But yeah, go slow. I think I've even done a thing where we will almost have like random half days or full days, and just to make sure that people are taking breaks. I think during this time too, when you're considering yourself essential, you're you're thinking that people are going to die if you're not there for them. And that's a lot of pressure you put on yourself. So um, and you don't want to die either. So remember that we're all going through it together. Also, everybody's an adult. We're all making the best decisions that we can at the moment, and to be really forgiving. I think also to remind myself, a thing that I've noticed between us harm reductionists is that when you start to feel crappy, you start comparing yourself to other people, right? There's a lot of like, I call it like the hierarchy of hurt. I think there's a lot of people who have different names for it, but like how much, trying not to cuss, how much crap you've been through in your life compared to what other people have been through in their life. So when someone comes up short on their shift or whatever, you're like, that person hasn't even gone through this and this and this. They don't know how to do this job, or and you start seeing that a lot more instead of swapping stories and sharing experiences. I was even think there was one time the other week where there's been some people who are just coming into their shells, and there have been some name changes and stuff, and people being like, why you gotta change your name? Why? That doesn't make any sense. I know you was this name before. And I just remember telling someone, why is that easier to say than just, oh yeah, that's cool, I like that name, that sounds pretty. And I didn't expect this response, so it's probably me being snippy too, but the person just looked at me and was like, oh yeah, I guess I could do that too. And they just carried on. I don't know, who knows, right? And what else? Or I think even talking about try to talk positive about people when they're not in the room too. I think negativity feels really easy, and it can be really bonding between you and other people, but it really, in the long run, it really disrupts a lot of feelings and a lot of the vibe, I would say. Like I don't know, we compare each other, we compare ourselves to each other all the time, like that, like even stuff of like I've heard people say like, can you believe they've only Narcaned like 4 people? That's like, what, you brand new or something? They've been here for like years. It's like, who? Why is that even a thing in your mind? So thinking about that, trying to be really mindful who you are, who you're sitting with, trying not to pass on your grief or your pain onto people who might be going through similar things or worse things, that you could be triggering other people into spaces. There's been a lot of like, because I'm a manager, that sort of, it's been difficult for me to have like attack each problem, make people feel good about each one of their separate issues, about how people are making them feel disconnected or not worthy, and also trying to hold the team together at the same time. So yes, mindfulness is probably one of the biggest things for me, and definitely for the union. And everybody's working on it and they're trying, but it is difficult. And then, yeah, give people the benefit of the doubt. I think the only thing else I was gonna say was we had an article come out in the Chronicle not that long ago. Someone wrote about one of our volunteers, whose name was Dre. And I wanted to say that as like sort of hopefully like an uplifting story, Dre had a lot of physical health symptoms. So when coronavirus started, we were really scared that he was going to catch it. If he caught it, it was going to be fatal for him. Everybody agreed, I think. So we started looking for housing for him really fast, and we were successful and got him into a really nice, one of those shelter-in-place hotels. And I would say he was probably in there for a month and passed away. So thank you, Shelley, for having that moment of silence. From an overdose, and just from all the reasons we already know, right? Nobody was there. You can't have guests. And as long as I've known him, for years I've known him, he's never even overdosed ever. So it was interesting and hard to hear that. And also just because he was a particular individual who had a really bad reputation for stealing a lot of stuff. So he didn't make a lot of friends for a long time. And he had told me one time that he was really scared that he was gonna die, 1, outside, and 2, alone with nobody, because he wasn't connected to his family either. And when I got the phone call that said that he had passed away, I remember taking a moment and then figuring out how to tell everybody. And it was just a particularly busy day at the union that day. And so when, I swear it was like 50 people there. And I remember telling everyone that Dre wasn't with us anymore. And it was a intense feeling because I had never seen a room sort of break like that. You know, it was interesting to see how like everyone's emotions are so on edge, that everyone either broke down crying immediately or just started yelling. It was intense, and it was needed. Also, it was cool that they felt comfortable to do that in that space. And then I think I realized also in that same moment that Dre, even though I don't think that was his time to go, that he died inside in a hotel room that he loved. And I bet you he would never have guessed that if someone told a crowded room of people that he had passed away, that everybody would have started would have reacted like that. I bet that, yeah, I bet he would have started crying. That it was cool. And just to remember that that we're essential for stuff like that, not just for making sure people have clean syringes, but that we do build community too. And we build, I guess, like hope for a lot of people. So, yeah, remember that as your essential also, and not just the supplies, not just the resources or the doctor's appointments.
That's
Welcome to session 2.
Perfect way to start session. Thank you so much, Miss Ian, for sharing that with us. It's been really a good way to have a reminder of the impact of this work far beyond the numbers or the little the important things we talk about a lot, but sometimes it's the emotion and the way people feel it deeply that we have to also remember. So thank you.
Of course.
All right. Well, now we are going to move into a slightly different session. This is going to be Dr. Kimberly Sue from the National Harm Reduction Coalition, who will be talking with us about policies that are related to doing harm reduction in the era of COVID-19, policies that you need to know to make sure that you can keep everyone safe. So I'd like to welcome Dr. Sue here. And I know that we're running a bit behind, and that's fine. We're going to make it up later. So don't worry about that. We will still end at the regular time, and take it away. Dr. Sue, thanks so much.
Hi, everyone. Thanks so much for inviting me and having me. And, it's wonderful to hear and see Miss Ian. I was laughing. You probably couldn't hear me. I'm going to try to share my screen and put my slides up. So, I'm talking from the other coast. I was recently I'm based in New York City. Actually, I just moved to New Haven, Connecticut. So it's actually interesting to reflect on, the health of people who use drugs and policies that affect people who use drugs from where I am, and listen to Miss Ian talking about what's going on the ground there, and then think about my experience being an addiction doctor and a primary care doctor, and doing that kind of work here on the East Coast, and thinking about some of the parallels and some of the similar struggles we're having that really are truly unprecedented. So a lot of this stuff I'm going to probably breeze through, and hopefully we can chat about it some more in the Q&A, or you can pop some questions that are more direct about this in the chat. You guys have probably already heard from people at the National Harm Reduction Coalition, but we create space for dialogue and action that help heal the harms caused by racialized drug policies. We do this in a variety of different ways that you're familiar with amazing people all around the country now. my disclosure slides that I don't have any disclosures to declare. And, so I think thinking about policies and thinking about harm reduction, it's very interesting to think about during COVID-19, all of these different components. That this is one of the slides that we always talk about when we talk about harm reduction. And, one thing that I do as a doctor is I try to disabuse the thought that many well-meaning people in healthcare have, that harm reduction is naloxone, or that harm reduction is equivalent to syringes. And it's so much more than that. And, really, when you think about COVID-19, you could think about ways that every single one of these areas is being strained. And you can think about why. And then you can also think about ways that policies that we have adjusted to that, have been able to accommodate, or have actually worsened scarcity, or in ways have harmed people who use drugs, the health of people who use drugs. So, for example, syringe access in New York, in New York City and New York State, we've had recently, syringe access has been very difficult even throughout the pandemic. You've probably heard some of the National Harm Reduction Coalition webinars we've had on different programs and different ways, like Ms. Ian was talking about, of adjusting to your essential work. But in many places, programs just shuttered completely. And there were periods of time that people didn't have access to sterile syringes, were sharing, still are sharing, reusing, still are reusing. And for example, in New York State, a lot of the money and the people that actually work on drug user health got pulled to COVID, right? And programs didn't get renewed. The cost of COVID in New York State is huge. And so what's always on the chopping block, what do we always fight for, is money for harm reduction. And so that's really been happening where, for example, there's an HIV cluster in Monroe County in New York, and it's affecting Black and Latinx people. Not surprisingly, there's some racialized disparities there, and really no one said anything about it. So everything that I've been worried about, it's actually coming to fruition. Everything that we scrambled to just keep people safe, alive, thriving, happy, we're just losing so much ground. And for example, people at New York State in the Office of Drug User Health, they're sometimes I'm meeting with them and they're oh, I'm actually running a testing facility in this part of the state. I'm on the ground in this part of the state. And so they're actually not even doing drug user health. So, it's really difficult. Really also, just every, all of these points that we used to have for people to drop in, for example, the syringe service program where I see patients who do low threshold buprenorphine provision in Chinatown, that's been shuttered. Drop-ins were just closed. These were the places for people that were using to stay safe, to stay warm, to get some food, to get some clothes, shuttered. People who left prison or jail, high risk of overdose death, high risk of a lot of potential health causes and harms, shuttered. So drop-in centers were closed, people were dying. I mean, those places are so much connection, so much trust, so much, just a place to go and just be off the street and just rest. They're all gone. So it's been really difficult. So really thinking about, housing, thinking about hotel programs, access to naloxone, all of these things, we can have policies that can be better or that can be not as good. So many people, for example, Laura, I saw Laura Thomas is here, so many people have died alone, this last year. I mean, we've lost so many people in the harm reduction community, and so many people, I'm not saying that an overdose prevention site or a supervised consumption space is a panacea, but I mean, people have lost kind of places where they used to be able to use and be, and be taken care of or be watched. And the isolation, the stress, the mental health strains of the COVID pandemic on top of everything have led to, increases in fatal overdoses. Pharmacy access is very interesting because, you know, for a while in New York City in March, I was thinking to myself, wow, like pharmacies I've always thought are the, you know, pretty like underutilized spaces from a harm reduction standpoint. You know, you could get syringes there, you can get sterile, you know, alcohol prep pads, you can get like so much stuff through the pharmacy. And in a way that's, you know, pharmacies are everywhere. They're, you know, there's, you know, you could really access stuff in theory really at a pharmacy, and very few people were going out. They were going out to the store and the pharmacy. And I was like, wow, we could really utilize pharmacies to get naloxone, syringes, safe equipment and works for people who use drugs through pharmacies. And, you know, again, they are places that there have been, unfortunately, a lot of stigma and a lot of harm. But in theory, they could be really great places. You know, I'm not necessarily going to go through this, and you guys are probably familiar with this already, but I'm just as a clinician, as a doctor who cares for people who use drugs, we just have been seeing a lot of people just push their use generally over to the right. Everything is getting, if you are a social user, you might be binging, you might be daily, this might be drinking. A lot more people are drinking. There is anxiety. And I just tell my patients, I'm like, this is not like, we are going through something we've never been through, you know, as a global community. Like, no, it's okay to be like, it's normal to be stressed. And it, you know, we need to think about your substance use, you know, like kind of trying to figure out ways that you're able to function and ways that we're going to tuck our heads down and survive this together. So I'm thinking, you know, I'm paying very careful attention to people who, you know, maybe we're using it occasionally or in certain circumstances who might just be tipping kind of into places where it's more difficult for them to kind of have a good quality of life and live their lives. So many policies, I'll just highlight a couple and then we can chat. But, you know, for example, in the spring, so there have been these moments, you know, where the pandemic has made us realize like, wow, business as usual is really fucked up, you know, actually, like, we don't actually have to do things this way. So there's all these moments of slippage where you realize, especially from a policy point of view, or even from a medical point of view, like, okay, so my patients used to come to see me, let's say every week or every month. They used to spend like half a day coming to visit me, like an hour from the Bronx on the train, wait for a while, see me, do whatever else I needed to get done, and then go to the pharmacy to get their medication, then come back. And then we realized, you know, during the pandemic, wow, like I can just talk to you over the phone, prescribe the medication over the phone, and you just go to the pharmacy and you didn't really need to see me at all. So these things, I hope, we can make an argument for permanent changes. So in the spring, there were significant changes that were made by the DEA, and, you know, don't want to be too wonky, but really a couple major changes for medication for opioid use disorder. Buprenorphine, for example, which is also known as Suboxone to many people. Basically what happened was we were allowed to prescribe it over the telephone, and we were allowed to prescribe it over telemedicine visits. And, you know, this has been really, I was just on a call yesterday with many doctors who prescribe it across New York State, and basically we can prescribe it to anyone, like someone who gets out of jail and has a flip phone or calls from a shelter phone. We can just be like, oh, okay, like, what's your date of birth? Like, are you at high risk of overdose? And I can get you medication literally over the phone. I don't have to do anything. There's really very little, you know, that I have to do to get you this life-saving medication. With methadone, there were pretty clear changes around take-homes. So take-homes were part of this punitive system that you all probably are familiar with, of earning them, et cetera. And really all of a sudden they're just like, well, your clinic can write for like blanket take-homes of 14 to 28 days. So every state, which has a different operating authority, was allowed to say, like, you can do this or not. Some people were able to go up immediately to 28 days because they've been getting whatever already, and some were not, and many places didn't make those changes. But it was pretty incredible to be like, oh yeah, like you can get this a month supply of this medication like you can get for your diabetes or your high blood pressure medication you can get. And there's no reason why you couldn't have done that before. Other policies, there have been some cities that have done withdrawal management and maintenance guidelines around alcohol, around opioids, and really trying to figure out, how to help people, who use drugs have a steady supply, knowing sometimes that the biggest harms can come from trying to abruptly cut off. For example, with alcohol, one of the biggest or most dangerous things that you could have is a withdrawal seizure or delirium tremens, DTs, that can kill you. And so thinking about, okay, the harms aren't from like, there are harms from drinking daily for years, but there are very specific, the harm that you die of a withdrawal seizure because you lack access to, 2 pints of vodka, that's very real. So there have been some cities that have been thinking about and working on getting those substances to people. SSPs and harm reduction services. So again, New York City, where I'm most familiar, and New York State have sent out a lot of guidance around how to practice how SSPs and essential workers can work to maintain their essential services. Syringe service exchange was declared essential by the governor, by the health department in the spring. And they also started secondary exchanges, which meant that like you could exchange out of an emergency room. You weren't primary tier, but you could register as a second tier. So doctors in the emergency room could hand out works for the people who might need them. So trying to increase access that way. Decarceration has been one of the biggest policies that has been attempted and somewhat, disjointedly done across the country to try to decrease chances that people will die of COVID inside. That's been a huge issue, and really, it's a whole separate talk talking about decarceration, but it's so important that we provide that care on the other end when people get out. Someone was decarcerated, they released someone from Rikers, with acute mental health issues who committed suicide very quickly, within a couple of days of being released. So when we lack access to, all these places we might call up or we might help people with are closed. People don't have phones. They don't have a place to go because they might have crashed or couch surfed somewhere here. No one wants them now because they came from Rikers, which had a pandemic. So it's really complicated, or might be going into congregate shelter. So again, just, some things to think about. Housing obviously has been a big deal. So I worked at a makeshift hospital that in Queens in the tennis center that basically mostly was a place for people who couldn't quarantine with COVID to isolate with, so they could come and have respite with us. So thinking about how do we get people housing, that is really what we know protects people from COVID, and safe housing. So many of the people I took care of during the peak pandemic in New York City were people living 5 people to a 1 bedroom, right? And everyone's working in the grocery store or the Chinese restaurant, and so everyone in that household gets COVID. Like COVID's a household disease, right? Or it's a viral, that process it's a household process. So thinking about what does it mean to have safe housing. I'm going to skip over this case study, but needless to say, the story is that we're just losing ground around the country, and it's really grim. And any benefits we've been able to make, sort of stabilizing overdose deaths and other deaths of despair, we've lost a ton of ground. This is my book. I was just talking to someone earlier in the day. My book's about getting wrecked. It's about women, incarceration, and sort of the opioid overdose death crisis. And really, one thing that's been interesting to me throughout this whole process of thinking about COVID-19 is really like the data sometimes doesn't really matter. And so as an anthropologist, I use a lot of the stories that we have from, you know, the people I've taken care of, my friends, my people who've died, the story Missy and told about Dre. I mean, these are really things that really matter. People's lives really matter. And so how can we talk about people's lives, people and their lives with dignity and respect, and make structural systemic change for justice? We have some stuff on our website that you know, has some concrete recommendations. Earlier in the pandemic, before I got called to COVID service, Cassandra Frederick of Drug Policy Alliance and I wrote a piece about COVID-19 and how US drug policy and racist drug policies, xenophobic drug policies were the structural violence that was fuel to the pandemic being, you know, racist, you know, Black people more likely to die of COVID, people who are unhoused more likely to die of COVID, people who use drugs more likely to die of COVID. And so check it out, check out that article. And there's lots of practical tips here on our website for how to use more safely, you know, how to operate your program more safely, for stimulant guidance, and other ways that you can try to keep yourself safe. So yeah, thank you so much. I'll stop there and look forward to chatting with you or hearing from you.
Thank you so much, Dr. Sue. We had some questions come in from the chat, but into the Q&A, but since we're running a little bit behind, I think what we're going to do is move on to the next interactive activity for everyone so that we can still end on time. But I'm going to invite Dr. Sue to stay as a panelist off video, but while we're doing the interactive activity, she'll be able to go in and type in the Q&A and actually type answers. And so hopefully you're willing to do that and type some answers to folks in the Q&A who didn't get a chance to ask it since we're running behind. So thank you so much for that. Okay, what we're going to do now is try another experiment. For those of you who did the breakout rooms in the morning, which worked, we are emboldened to continue. So we're going to try something where we are going to go to interactive mural boards, and I'm going to quickly share my screen to just demonstrate what it is that we're going to do. So we have 4 mural boards set up. Mural boards are basically, if you imagine that we were in a room together in a huge auditorium and we put big pieces of paper up on the room and gave everybody Post-it notes and pens and paper and said, go around, write some notes on the Post-it notes and stick them up on the relevant boards. This is what the same thing is, except we're doing it virtually. And so if you are worried about the tech, or if you are on an iPad or a smartphone and aren't able to use these links and connect, then I will be sharing my screen, and it won't be as interactive, but you'll still be able to participate. So no stress. But for those of you who are on a computer and feel like you want to give this a shot, what we will do is in a moment, we'll put 4 links in the chat to 4 different mural boards, and they each have a self-care theme on them. You can see them here. And when you go to any one of the links, it will look like this. This is the link to board 3. They'll all look roughly the same. And it has the title at the top. And then basically it has a way that you can just add Post-it notes. And I'll show you on the next screen. But you click over here, this little Post-it note in the sidebar, and then it'll let you pick a color and you drag it over and you can type and add a virtual Post-it note. And then when you're done answering that question, if you want to try another one, you just go to one of these 3 circles on the left, and it'll let you jump to another board. There's a hyperlink. I did not design this mural system, and so I have to tell you, unless it's it could be user error, but I couldn't make the entire circle a hyperlink. It's this little white spot at the bottom, which isn't quite as little on your actual screen, but basically go to that little piece at the bottom of the circle, click it, and it will open a new browser for you that will be board 1. And then when you want to go to board 2, you click there and it will open a new browser new browser tab that's board 2. So you should be able to navigate around, and hopefully it'll be pretty easy. If it's not easy, then just come right back to the Zoom window. We're going to stay open. You'll be able to hear me talking, and you'll be able to actually watch me navigating between the boards in case you just want to watch. So I hope that you go, you don't need to sign in. It'll ask you if you can put your name if you want, but otherwise it'll let you be anonymous squirrel or anonymous snail, and you can just accept that and be anonymous, and you'll see everybody moving around. So I hope you find this to be a fun activity and a way to not only add your ideas about self-care, but see what other ideas other people have. We will do this until 1 o'clock and have a hard stop at 1 so that we can start streaming the video for the San Francisco Drug Users Union, where Miss Ian works. I promise you, you do not want to miss this video. So I hope that you are really ready to come back to your Zoom window at 1 o'clock so that you can see that. Then we will have some closing comments and then a really excellent training on self-care for harm reduction workers. So that's what we have left. Okay, we're going to put those links in the chat. And I'm going to stop sharing. You should go ahead and click on whichever one inspires you. And then I will, again, share the pages for anybody who just wants to watch. But otherwise, we'll meet you back at this Zoom window at 1 o'clock. Thanks, everyone. All right, everyone. I hope you thought that that was a fun and not too tech intensive diversion. I was on mute, but I was laughing a lot. There were a lot of really, really good answers and a few things I want to remember to try myself. So thank you all for participating in that. If you haven't already come back to your Zoom window, please come back so that you're seeing my face talking to you. Because we are about to start streaming the video for the San Francisco Drug Users Union, and you don't want to miss it. In case you haven't joined us for the other sessions, I'll just say quickly that when we thought that this symposium was going to be in person, part of the idea was that we would have people here in San Francisco. And so after a day of listening to presenters and having conversations together, we would have an opportunity for people to do site visits and actually visit some of these organizations, learn from them, see in action where they are, what their space is, what's their special sauce. And when COVID made it impossible for us to do that, we decided it was a good idea to pivot and not lose that entirely, but instead we partnered with a local filmmaker who worked with people in each of these organizations to shoot their own footage in their own spaces, in their own ways, and take part in editing it into 5-minute virtual site visit videos. And I just cannot say how impressed I have been with how all these videos came out, especially given the way that they were made. So I hope that you enjoy it. I think there's no better way to close it, close this series of videos than with this video from the San Francisco Drug Users Union. I hope you enjoy.
My name is Ms. Ian. I'm currently the Executive Director of the San Francisco Drug Users Union. The union is buying for people who use drugs. The main difference is that it has less of a medical feel, more of a community center vibe.
I like the fact that I could see my friends like that I couldn't normally see because we don't really have a place to meet up like out there, because when you're on the street and you meet up somewhere, usually you're gonna get told to move along eventually, wherever you are.
I love it here. They're friendly. It's somewhere to get away. You know, if you just want to hang out.
The Drug Users Union is about giving people opportunities that wouldn't normally have them.
But it's also where people can see their friends
who they thought would never have a job, having a job, working in front of them, helping them, being of service. And that is an incredible thing.
Hi, my name's Robert. I've been working here at the Drug Users Union since April of this year. It's the first time I've held a job in a long time. It's made me feel better about myself. I'm able to take care of myself, keep myself well most of the time. I love working here.
In harm reduction, there was a lot of pull to hire people who use drugs at their organizations, but those people wouldn't last very long. And so we decided to structure our organization to better fit the needs and the schedules and the lifestyles of people who use drugs who are also living in a sort of chaotic state.
I've worked here a little over a year. The last time I had a job was 10 years before this one. This is a very, very important place. I realized that before I started working here. I realized that when I was just coming here.
I know that it's not a model that is being used often, so we're experimenting a little bit, and to be honest, we're having hiccups all the time and we're figuring it out as we go, but hopefully you can tell from this video that people feel good about it. A lot of us don't have anybody in our corner rooting for us, and to all of a sudden have a whole community, a whole organization that is behind your personal growth feels amazing.
I feel like I have a reason to go out and see the sun.
Oof. Well, love that so much. We're going to put the link to that video in the chat, and we will be sharing all of the videos with all of the attendees. We'll be sharing links to all 4 of the videos that have played during the symposium. And we really encourage you not only to view them again yourself, but to share them with anyone you know, put them on social media, get them out there. These are people worked really hard to make these incredible videos, and we'd love to get them out there beyond what we have done with this symposium. Okay, well, now we are going to move into closing comments, which is a little funny because we still have an hour left in the symposium, but we decided when we were planning this that it made sense to have about 10 minutes of kind of formal closing comments to really tie things up nicely, and then move into, for the last 45 minutes, a training by Tanagra Melgarejo from the National Harm Reduction Coalition. For those of you who feel like a training about self-care for service workers is really relevant or for you, or something that you would like to learn and experience so that you can share things that you learned with other people around you, we absolutely encourage you to stay. But for anybody who feels like that isn't something that's relevant to your work or something, we wanted to have closing comments and then give you a chance to move on with your day. But we really do hope that you stay. It's going to be a really excellent training. And so before we move to that training, I'd like to introduce Laura Thomas from the San Francisco AIDS Foundation, who is here to provide us some closing comments and officially send us off in this symposium with some words of wisdom. Thanks so much for joining us, Laura.
Thank you. Thank you, Shelley, and thank you to all of the folks on Shelley's team and everyone at the San Francisco Department of Public Health and the National Harm Reduction Coalition and others who worked on this. I'm honored to be able to play a role here. And so I was asked to provide some sort of wrap-up closing comments. I'm currently the director of harm reduction policy for the San Francisco AIDS Foundation. Before that, I was with the Drug Policy Alliance for about 11 years. And long before that, even, I worked for the San Francisco Department of Public Health. So I've seen this work both from a public health perspective, from an advocate perspective, from a service provider perspective. And, you know, for me, like just pulling out some of the themes that I've been hearing here and some of the things that I think are really core to harm reduction and some of the things that I'm hoping that you're hearing in all of this. And for me, one of the biggest themes is about connection, relationships, partnerships. How do you build relationships with people? And that the core of the harm reduction work that we do is it's so essential to build different types of partnerships and really strengthen relationships, and that can take time and it can take care, but we need to build trust, and in particular, trust across departments of public health, community-based organizations, and community members themselves. And that can be really challenging. Public health in this country, while I firmly believe in public health as a force for good, we also have a lot to answer for in terms of the ways in which public health has been used to uphold the status quo and to uphold, in particular, white supremacy and economic inequities. And so to undo some of that, and we're going to have to undo some of that in order to build relationships, particularly with the communities that have been on the other side of that work. And so some of the things that I think are really core to harm reduction that we need to do have to do with undoing the stigma around drug use, undoing the myths and inaccuracies that have been attached to people who use drugs, the stereotypes, particularly the racist stereotypes that have been attached to people who use drugs. And one of the best ways to do that is just to center and listen to people who use drugs, and to center those communities and understand how to listen, and listen on their terms and not necessarily on our terms, coming from an organizational perspective. And that means, learning and understanding about the ways in which the war on drugs is a system of racial control and the way it's been used to uphold a lot of these racist systems, and that to break that down and really listen and hear about what people need. And I think you heard that in some of these presentations today in particular. It's not enough to just go into a community and say, I know what you want. If we're going into a community, first of all, we should be that community. We should be hiring people from that community, and then being able to go in and say, what is it that you want, and how can we partner on this, and how can we build relationships for that? And so one of my other appeals to folks who work in health departments is to figure out how to say yes. Bureaucracies are best at maintaining the status quo. That is what bureaucracies are intended to do. But figure out how to say yes to communities, how to say yes to harm reduction organizations, how to say yes to funding them, how to say yes to helping out. If they're saying we need some help, the police are harassing our participants, can you help us out? Even just small things. You've got $10,000 in your budget at the end of the year. That could buy a lot of naloxone for a struggling volunteer operated program. You can start small with things like that, but those sorts of things can really make a difference. Be creative, try things that aren't the usual process, and harm reduction is often about breaking down barriers. So break down the barriers to your usual process and try new things. Some of the greatest innovations in terms of harm reduction, things like peer distributed naloxone, syringe access in this country, supervised consumption services in other countries, have often started as direct action or civil disobedience, or just sort of people doing something even though it wasn't necessarily legal. So be willing to be a part of advocacy efforts to change those laws, recognize when people are taking a risk, and figure out how you can use your health department to support people who are taking those risks. And to figure out, and I know this can be challenging when you work in government, but figure out how to be a part of policy change. So much of the experience of being a person who uses drugs in this country is being on the receiving end of a lot of really horrific policies. And that's what determines the conditions of existence of so many people who use drugs. And it's about, the criminalization of drug use to begin with, but then the ongoing and collateral impacts of what that means. If you're incarcerated, if you have a conviction on your record, can you get food stamps? Can you get public housing? Can you, are your kids taken away from you? Figure out how to work to change those policies and change those conditions of existence for people who use drugs, because that is often what people need in order to make changes in their drug use and changes in their health and well-being. So, figure out how to be involved. One of the things that's happening right now, there's a ballot initiative in Oregon around decriminalizing personal possession of drug use, and decriminalizing drug use, ending the criminalization of people who use drugs is going to be one of the most important things to really addressing drug user health. It's one of the most significant structural things that affects drug user health, because it means people are more vulnerable to policing, to incarceration, and to all of these collateral consequences. So, figure out if there's a way in your personal time, in your work time, to step up, talking about the ways that incarceration hurts public health, for example. Can you get your public health department to identify some of these things that harm public health? And it wouldn't be me if I didn't specifically highlight supervised consumption services. As Dr. Sue mentioned earlier, obviously it is not in any way a panacea. It is not the solution, but it is a solution. And when we are facing the kinds of overwhelming overdose deaths that we are, here in San Francisco, more people have died of overdose since shelter in place began than have died of COVID. Like dramatically more people have died of overdose. And everything that we're doing to stop the spread of coronavirus is absolutely necessary. And we need to be doing so much more to stop these overdose deaths. They were preventable, predictable. We can do better. Housing is one answer. Supervised consumption services are another. So, harm reduction is really easy. Harm reduction is about putting on a mask. We're all doing that every day. And harm reduction is really, really hard. And it involves engaging with folks with huge amounts of trauma and intersectional oppressions and injustices. But, bridging from that easy part of harm reduction to the hard part of harm reduction, so much of it really just comes down to love and connection and trust. And it's about loving people who use drugs. And I think, wherever you are in this journey, finding your way to being able to say, I love people who use drugs, and it makes everything else so much easier. So those are my closing comments. I've really enjoyed this set of presentations, and I'm honored to be a part of it. So thank you for inviting me.
Thank you so much. What a great way to close the sessions we've had for these last 2 days. All right, well, now we are really going to close the symposium with a training. Before we do, I just want to say a thank you to the San Francisco Department of Public Health mentorship team and the symposium planning team. This is a group, the mentorship team was matched with specific jurisdictions, health departments in the US to provide mentorship around overdose prevention and supporting people in other counties around drug user health. And when we needed to pivot to a virtual setting, the SFDPH mentorship team really wanted to create a symposium that could be accessed much more widely. And as a result, we were able to make this a national event that we had people joining from all over. And we're really glad that we had such a wide range of people participating. And so thank you to the people who worked so hard to put all of this together. I'll be back at the end to say some more official thank yous and send everyone off officially. But for the next 45 minutes, we'd like to have this training about self-care for service workers by Tanagra Melgarejo. And we're really excited to have you here with us for the next 45 minutes. Tanagra, thanks.
Thank you so much, Shelley. And I am honored to be in community with you all today. I'm going to share my screen. So hopefully this will work. I think it does. And then we put the captions on. Perfect. Thank you. I always get nervous that technology will fail me at some point. So as Shelly mentioned, I am going to be, for the next 45 minutes, we will be chatting about self-care for direct care workers. And I have to say that self-care can be a really loaded topic for many of us, and also that we cannot have care for self if we have not, if we don't engage in care for community, right? So that's something that I want us to also think about, how care for community is a big piece of the way that we can care for self, particularly now in the current situation that we are living, and with the added uncertainties, stressors, and challenges that COVID has presented for us and continues to present, but also just in general, the status of the world and what's happening and the impact on us and our participants, the folks that we work with. And so I am part of the National Harm Reduction Coalition, and we have a North Star statement that helps guide our work and centers our energies, and that is that we create spaces for dialogue and action that help heal the harms caused by racialized drug policies. And we really firmly believe that the war on drugs is a racist war, it's a classist war, it's an imperialist war. It's a war that is rooted in settler colonialism and violence to communities, and that communities of color have been primarily affected, directly affected by that war on drugs and by those policies, and that those policies also affect white folks, but people of color are exponentially impacted by them, and that we need to address that. And we do that through policy and advocacy, through national and regional conferences. Our conference was supposed to be happening this month in Puerto Rico. It will be happening in 2022, hopefully, in Puerto Rico. So at that time, hopefully we'll see each other in person soon. Then we also provide trainings and technical assistance, overdose prevention, and resources and publications. We have, as you can see, we have new branding, and we have relaunched our webpage, our website. So I encourage you to peruse it in case you want to access any information. It's really lovely, and there's many resources there that are available for folks to download free of cost. If there's something that you're looking for that you can't find, you will find my email at the end of this workshop, and you can certainly reach out to me, and I'll be happy to either look and identify and send you what you're looking for, or put you in touch with the person that knows where you can find it. And today, my goal is to think about the ways that we as direct service workers in caring professions are exposed to structural violence on a daily basis. And also, that is tied to experiences of vicarious trauma. So if we don't deal with that stuff can keep sort of like, amplifying, and it can get to the point where we are experiencing burnout and compassion fatigue, and it's really harmful to our health, to our community's health, and to our participants' health as well, and well-being. And so in this session, my hope is, in this 40 minutes that we have together, is to just sort of start thinking about some of those things and think about ways in which we can identify that stress, those stressors on ourselves, those things that are challenging for us, like how are they connected to our own experiences with trauma and the systems that are violent and harm people, because they harm us too. And how can we engage in sustaining community care for one another, for self and for others. So we are going to have an activity. I think folks have access to the chat box. So I'm going to ask folks to think about the following. If you want to think about your stress level from 0, where it's not stressed, and 10, which is extremely stressed out, I would like folks to kindly start in the chat box, chatting where you think you're at. If you feel, oh, I am not stressed out at all, so I am in between 0 and 1, or I'm feeling pretty tense and stressed. So I'm seeing a 3. I'm gonna start adding this. Thank you. A 6. 4.5. Thank you. 4. 5. Awesome. 6. 8. Would like to be a 1. I know, right? How do we get there? Absolutely. Thank you, folks. 5. Give it a couple more seconds. So where would you like to get there? I need some time at home to unpack after a move. Absolutely, right? So it's time for self. So in order to lower stress, sometimes we need to be able to find the space and the time to be able to center our needs and care for ourselves, right? So thinking about the stress scale, like what would be something that would help you get to that 2 or that 1 or somewhere in this scale where it would feel like the stress is diminishing or feels more manageable? If folks want to chat that in the chat box, that'd be great. So we have one response, which is having time to be able to manage like our day-to-day life things, right? That life doesn't stop because we're at work. Support at work, right? Gail is sharing with us to support at work and like having, and that can, you know, if we think about that, it's like, how do we have a team to support us? How do we have structural supports within those systems to help us, right? Also being able to ask for those supports and feeling like we are able to ask for those supports, right? That it is okay, that it's accepted, that we're not going to be punished or shamed because we're saying, hey, this is hard, this is difficult, I would like someone to support me, right? To have our own space, to have, you know, a space that feels like when we come home, we're able to be in a space that feels like home to us, where we don't have to navigate maybe stressful situations or tensions or navigating things that come up that continue to build up on the stress that we acquired during our work day. And someone is sharing in the chat box debt. Absolutely, debt is a huge stressor for debt and the fear of engaging in debt or having to be in debt, right? Because we are in a pretty significantly difficult world situation at this moment, and things are really uncertain, right? And just the thought of having that debt or acquiring more debt can be absolutely stressful. Thank you, folks, for sharing that. Now we are going to move to the next slide where I have some more questions for you all. So now in terms of the support scale, I would like folks to share where they're at right now at this moment in terms of support. And when I think support is, think about, you know, you're feeling really supported by your people, by your community, by your friends, that would be a 10 or somewhere around there. And when you're not feeling that you're having that social support, where would that be? So I see an 8 here, 5, 7, 8, thank you. Thank you. 9 for 5, absolutely. And I want also folks to start thinking about what would help you get to a place where you would feel more supported. Like what would help to get to a place where you feel that you have the supports, the social supports that you need to feel safe and comfortable. A nanny, absolutely. So having support with, you know, with raising children, particularly if we're caregivers and parents, right? Or we have, you know, we're parenting in any kind of situation that can be really stressful, and having a support team to help with that certainly can make us feel cared for, and that we're able to then give from what we have, right? From what we have, that space of care for others, and to show up in a way that we feel good about. To have a cohesive team at work, to feel that we can trust people, that people have our back, right? That that the team is with us, and that we can have those tough conversations, but also to ask for support. To have our people around us respond to us when we're initiating contact, particularly like if we're sending messages. So checking in with folks, making sure that we're able to, if we're checking in, to feel that we're getting that response back, right? And also seeing leadership models, you know, of behavior that we want to see different, right? So we may be saying, yes, care is self-care is great, but if the organizations or the spaces that we're in don't support that model, right? And when they embody everything that is different, it's really, really hard for us to feel that we can practice care for self, but also that we can ask for the things that we need. Absolutely. Thank you folks for sharing that. And then I think we're gonna move to one last one. And now in terms of the self-care scale, from 0 to 10, where are you now? How efficacious or good is your self-care? You know, you feel you're like, I am knocking it out of the park with my self-care. I am doing really, really good, or I am not really good at caring for self. Where are you at in terms of that? I see a 6, a 3, 6, 9, 5. So think about where you would like to be and what would help you to get there. So what would help you get to a different place in this scale to move? If you want to move from where you're at, what would help you move there? Having a plan and having an accountability buddy, I love that. Having someone that I can check in with to make sure that I am doing the things that I said I wanted to do to make sure that I can care for self. So more sunlight, absolutely. That is super important, being outdoors, being in the sun, having some time away from work, and being able to play music or, you know, to exercise, to move our body, right? To feel that we have spaciousness, right? That the day is not collapsing in on us, right? That we have enough time to do the things that we want to do because we have social supports and community supports to help us, you know, take care of some of those activities, right? Those are all things that can help us navigate care for self, right? And I love the fact that someone's sharing self-compassion and acceptance, right? I feel a lot of the times self-care, I feel can be a really toxic sort of concept because A, it's putting the onus of care on the person. So if I'm not caring for myself, somehow I'm screwing up, I'm a bad person. And B, if I don't know how to do it, there's no right, I don't believe there's a right or wrong way of doing this, right? You do what feels good to you, but there's this expectation somehow in the systems that we're in, we have to do it in a certain way. And so that can add another layer of stress, right? Like I am trying to care for self and I'm stressed out because I feel I'm doing it wrong or I'm not doing it right or I'm not doing enough, right? And so all of that can become a barrier for us to be able to really articulate what it is that feels good to us, that we can do, the things that we can try out, and that we can integrate those things, not only leave it up to me as a person, but as I was saying, to create social and structural conditions where we are accountability buddies for each other, that we are making sure that folks are being able to feel cared for and that they can care for others, not only at home necessarily, but at work and within any of the systems that we operate under, right? That we are able to articulate our needs, that we're able to offer supports to others. That's part of that community care as well. And that we have common language and common vision around those things. And that we are encouraged to ask for what we need. Thank you, everyone. So when we think about, these are the things we're thinking about. So we're thinking about ourselves first in this concept, in this moment. And now I want us to think about, you know, we're working with people, right? We're direct, you know, if we're here, we are engaging with people in different capacities. So what do you think are some of the impacts of caring about your works and your clients? Like how is caring for folks and caring about the things that you do having an impact on you, particularly now in this historical moment that we're in? It's more stressful. Absolutely. Yes. We have more stress. So it's added that extra layer of stress, right? Of concern and worry. I think we were listening before to Laura do a recap of the things that you have been chatting about throughout this summit and, you know, thinking about the social structural conditions that are folks that we work with are facing every day, and that there's an added extra layer of concern, you know, for their health and well-being, and the fact that like the systems could see the harms that were coming and have done nothing to address those things, or have done the bare minimum, right? And now we have, you know, added harms, or harms that have been magnified, right? And the impact that has on us, right? So someone is sharing with us that it's feeling like our cups are full, right? They're over brimming, or they're brimming over. I don't know if you say that in English, but like they're pouring out, right? And that the work is personal, it feels personal, but also how do we balance our work through boundaries, right? Like how boundaries can help us to minimize or to address some of the impacts of caring for our clients and for our work, right? So we know that like caring for people, you know, it's emotional labor, it's work. And sometimes, you know, we care for folks and that feels deeply, profoundly personal because we have shared lived experiences, or because we have developed relationships with these folks, right? So certainly it has an impact in our well-being, our emotional, psychological, and physical well-being, right? And so when we're thinking about what drives us to care about others, the more we care, it's no surprise, more stressed we are, right? So if I am someone who's altruistic, where I am putting aside my concerns and I am leaving myself behind to take care for someone else, right? I forget me to care for others, that increases stress, right? And altruism can be really beautiful, but it's not necessarily the best thing sometimes for us, right? So it's thinking about, you know, how do we care for people whilst also caring for ourselves, right? Not losing track of what we need, of what we can give, of what we can offer. And it's thinking about then how do we move between empathy and compassion, right? How are those, you know, how those particular steps as we see them here, where we see someone and we connect to them and we share, you know, we connect to their emotions, we recognize them as people, right? And we still have the ability to connect to that human and not forget of us, right? So we're able to be there for them and still be in a place where we can still take into consideration what our needs are, what our feelings are, what our emotions are. Sometimes when we're doing this work, there's days that are better than others, as you can imagine. And I know you probably have felt this. And there's times where we show up at work and my best that day is not the best that I could give the day before, right? I've had things happen in life. I showed up at work and I had like 3 hours before showing up at work where I was dealing with things that impacted me. And so the way that I can show up that day is maybe not as present. And it's okay to say that, right? It's okay to say that I am here, I'm gonna give my 100%. And maybe I need a partner or a coworker to step in, you know, because the kind of emotional labor that maybe is required of me that day is not the thing that I can do because I don't have it in me. I cannot give what I don't have. So it's really thinking about the more that we care, the more stress that we have, and being mindful of that in terms of also figuring out ways in which we can handle and cope with that stress. So when we think of stress, is the non-specific response of the body to any demand for change, right? So when we're being exposed to ongoing toxic stress, and that's trauma, particularly, you know, when we think about being exposed in the womb, it definitely affects, and there's studies that show this, they affect the development of organs, kidneys, hearts, and brain, like all those organs are impacted since the womb by stress and by that trauma. And the body releases hormones that increase heart and breathing rates. Your muscles are getting ready to fight, run, or play dead, right? So when we're thinking about stress, it's important for us to connect to our body and to think about how does our body respond to stress. Like, and that can be different in different situations, right? For me, I know I feel it in my gut immediately. Like I was talking to you about this. I felt it in my gut. Like I feel that sense there's a contraction, something that happens, and I'm bracing myself. I work with someone and we talk about the way that our amygdala can get hijacked, right? Like I can see my breathing getting quicker, right? Like my gut getting tighter, and I am ready to like get out, right? Because my thing is to run away as far as I can. So I already know how my body operates under stress so that I can be mindful when I'm feeling those things. Those can be flags that I'm mindful of to help myself then counteract that stress, right? So there's 3 responses and they all can happen at the same time, right? Or there's one that maybe is the one that is primary for you. So there's the fight, response, which is I can overcome this stressor. Let's do this. I'm like, yes, I'm going to go out and vote, and I'm going out next week, and I have my voting things here, and I'm taking them to my voting center, and yes, I can overcome that, right? Then it's their flight, which is, this is too much, I'm out of here. It's like, oh my God, no, I am going to get into my, I'm going to build myself a fort. I'm going into my cocoon. I am turning off my phone. I am turning off my computer, the TV. I'm just laying here and I'm not waking up for the next 2 weeks. And then there's the freeze, right? Which is, I can overcome this. I can safely run from it. So I'm going to block this whole thing and play dead, right? So there's also like the piece of like our body and our mind dissociating, right? Which is, I freeze because I can't move. Like sometimes if you see, for me, when I've seen car accidents, I freeze. Like I can see that, like sometimes like the car may be coming at me and I can't move because my brain and my body are like asking and saying, hey, in order to survive, you have to get disconnected in that way, right? So understanding those stress responses and recognizing them in us is really important, right? As well as understanding the stress on helping professionals. Short-term stress is good because it helps us build resilience. It builds compassion and satisfaction, right? What we're talking about here is the long-term chronic stress. That is not so good. That's not the stress that we want, right? Like short-term stress is I'm taking a test, I'm gonna ace it. That's awesome. Or like I'm helping a participant to work through this particular process and they got, the documents they needed. That is good, right? Like that's resilience, that's compassion, satisfaction. But then there's the long-term chronic stress that we're talking about, which is burnout and compassion fatigue. That's the kind of stuff that can be really harmful to us and to the folks that we work with. And so when we think about burnout and compassion fatigue, these two things intersect, as we were saying. And so when we think about burnout, there's things that are specific to burnout, and then there's things that are specific to compassion fatigue. And I want us to think about, or look at the place that these meet in the middle, right? So both are similar in that there's isolation from others. It leads to mental, physical, and emotional exhaustion. There's a reduced sense of meaning or accomplishment in a work setting for us. And burnout and compassion fatigue can occur together or separately, right? So when we think about this, I know when I felt burnout and I know when I felt compassion fatigue, and I know when I felt both, right? So it's important to think about how do we identify in ourselves when we may be in the road towards compassion fatigue or burnout, or if we're there, what are some of the things that we can do to be able to walk ourselves out of that space? And who can support us in doing that? And something that we can do that help us to get out of that place, that helps us to move, is resilience, is building resilience. And it's the 3 S's: self-regulation, self-awareness, and self-care. So how do you regulate your behavior and your emotions? Like, how do I self-regulate? I'm learning to breathe. So when I feel my amygdala going into hijack, when I feel I'm going to start like running, I just center myself and I just breathe, right? I breathe and then I inhale some of my essential oils because this really helps me, right? That's a way to self-regulate. To have awareness, like self-awareness is also really important, right? Like how do I stay aware what's happening in my body, mind, and spirit, and how I'm like engaging in that self-regulation? And finally, the act of care for self, which is how do I care of me in order to continue to live and do this work? This is our instrument, right? So it's really important for us to make sure that our instrument is the best shape possible, right? So if I want you to think about this while we go on to the next slide, which is what are some techniques that you use to manage stress and take care of yourself? So when you're thinking about, stress, what are some of the things that you're doing that you find that have been useful for you to, in stressful moments or to facing stressful situations that are continued in your work that have been helpful to you to care for yourself and to navigate that? And I mentioned breathing. It's for me has been really, really helpful. Also using essential oils has been really helpful to be able to center myself and to manage stress as well. Asking for help from my colleagues is also something that has been really helpful. When I have felt that I'm in my cup is full, right? To say, hey, can you come in and take some of these, help me with some of these, because I am not in a good place today to be able to do that. If folks have other techniques, I encourage you to chat them in the chat box. We'd love to hear them. Listening to music, for some folks is exercise or moving around. Meditation can be really helpful for some folks as well. That's another thing. Having conversations. I have a colleague that calls someone that they love and that reminds them of why they're doing this work and how it feels good to them. So like, you know, being in nature and disconnecting, calling a friend. Sometimes the other thing I do sometimes is I look at baby animals, right? Like that really helps me. It's like, oh, okay, I can laugh. Laughter, it's a way also of caring for self, of finding joy in the things that I have in my life, and that connects me back into my purpose, right? Or connecting to my purpose through other means, right, as well. And so some things I want to leave you today in terms of mindful care is for us when we're like in a moment, sitting at our desk, walking in nature or in a place where we feel comfortable to just relax and think of this. Is how do I care for my body? How do I care for my emotional state? How do I care for my mental state? How do I care for my spirit? And how do I know, right? Is how do I think about these things? How do I find ways to embody some of these, to create space for some of these in my life? How do I do this with my community, with my people, right? As well, because as I said, care for self is not disconnected from care to others and care from others. And so I want to thank you for being here in the last day of this summit and for taking the time to be in this community with me. I appreciate it. My email is here in case you want any information. I encourage you to peruse our website. Let me know if there's anything you need from us. I'll be happy to share it. And I think I can share Shelly has the slides, so I don't know if you're sharing slides, but feel free to share them with folks if they want to.
Great, thank you so much. I do have the slides, and thanks. We haven't asked all the panelists if it's okay to share, so I'm not sure if we're planning, we'll have to figure out if we're planning to share them all, but we will definitely share those that we have permission, including yours. So thank you so much. And I also wanted to say, you learn something every time you do a new event, and I have not seen that live captioning happening, but it made me regret we haven't had it for the entire symposium. So I'll have to be in touch about exactly how you set that up. It was a great accessibility thing. So thank you for doing that. All right. Well, that was a wonderful training and a great way, I think, to end 2 days. It was probably a little more stressful for me than for the rest of you, at least I hope so. But it was nice to listen to that training about self-care and participate. So thank you, all of you, for joining us for this symposium. I want to just close again by thanking the presenters, panelists, facilitators who helped make this happen, the San Francisco Department of Public Health mentorship team and the symposium planning team who worked very hard to put this all together and to make it as broad and accessible to a wide group of people as possible. And of course, thanks again to the National Association of City and County Health Officials, whose entire program to support health departments with mentorship, pairing health departments up around overdose prevention and drug user health is so important. And we're really glad we were able to do this symposium as a small part of that much bigger program. So in the days following the symposium, you will receive an email. We'll try to keep it to one email, maybe two, but we will send along materials. We will ask you to fill out evaluations, and it would be really excellent if you do that so that we can learn for future endeavors. And please do share those video links and any other information that you got out of this symposium that you find helpful. Thanks so much, everyone, for participating. Take care.